You ready?
I'm ready. You're on.
Okay. We are talking about things she can do for her skin. She's been numbing. The first thing that bothers, right, it's your tear trough or this. Does you feel like it makes you look tired? Anything novel or the same thing everybody says pretty much?
Yeah.
And smile for me. So you also notice how her brow comes down. So if I have a little bit of Volbella left after I do this, I'm going to put a little bit here to kind of pull that up. And we're going to do a little bit of Botox right here. Relax. She's got this pigment. So most of these spots are about 60 microns. So you have two choices when it comes to pigment. You can do BBL or broadband light, which treats the reds and the browns. This has no downtime associated with it, other than it gets a little bit darker. So here's an example of a neck. And here's a chest. So you see, I mean, it does a great job, and that's just one treatment. It can take more. And a lot of people say that the brown spots don't bother me because I can cover them with makeup, but the shadows are what make your face look overall dark. Like this is a good example of that because it's just bright, and that's 2 weeks after. This is the micro laser peel like we just did. This is 3 passes at 30 microns. The spots you don't have melasma, you just have some dark spots, and those dark spots are about 60 microns deep. And 60 microns would take you 4 or 5 days to heal. You've got thick skin, it'll help the pores, the fine lines. That's called micro laser peel. But that's about how deep they are. And that's kind of the result that you could expect.
Alright, do you feel nice and numb underneath the eyes? You think so,
I hope
as
so.
far as you know? Alright.
So we're going to start with the Volbella. First thing is to make sure people are sitting up as much as they can. I'll let her sit up again in a minute. You can put your head back. I can see it, like the subtleties of it. It's always good to have people sit up. Everybody looks good laying down. Right, Chloe? Did you ever try that?
Not when I open my front camera, I don't.
I'll have to show you.
You'll have to help me.
Maybe later. When we're not backing. Another level. So, but really when you lay down, this goes away. So, sit up for me and let them see. See, it's, I don't know if anybody can appreciate that. I promise it's the truth. And it also doesn't cause tech neck, which we were just talking about. Put your head back. It's the only way to get Chloe after her phone used to get put in jail. You remember that?
Yes.
So little bitty pieces. Are you okay?
Mm-hmm.
One to 10.
Pain-wise.
You okay?
Being the worst.
11. 1 to 10. Am I hurting you on a scale of 1 to 10?
Oh, sorry. Like a 2.
7. So we're making, I mean, that's just a beautiful difference. But I have to look at it from every angle. So the lower lid lengthens with age. Here, Ashley. Put your chin down a little. She's a little flat here.
Yeah. Okay, so Vicki Taylor asked how much would this cost? We're using the Volbella underneath your eyes, and it's about $500 a syringe, and it lasts a year.
And we have some rebates.
And we have some rebates for filler right now, so would be a good time to do it.
That's a tricky area. You have to be real careful with it, but she's flat there.
And in a minute, when she removes it again, I'll show you guys the difference.
Looks really good. You okay?
Mm-hmm.
I just don't want you to get a bruise. We always treat our bruises. Nobody wants a bruise.
How do you treat your bruises?
Spray tan.
She's a first-time spray tanner officially.
I know, and I had so many bruises.
She never done a spray tan?
She'd never done. Well, she's never needed to.
Well, yeah.
Well, I have, but
you know.
you know the worst part? Is totally, have you ever had a spray tan?
You're the last one to the party.
Yeah, that's just you. Welcome.
When you turn around, we did this to Tisha. Shout out to you if you're watching, pregnant, you better laugh. But we just gotten our spray tan and we were spraying people, and you know, like you have to lean over, facing
To get the
opposite.
underbutt.
Yeah, and she was like, lean over, and I was like, I guess it could be worse. Like all I could think is, like, what if you had to lean all the way down? Then you would know that. You know what I mean?
Yeah.
Anyway, that's my spray tan story. But other than spray tanning for bruises, we use BBL or broadband light, and we have a filter that it makes it go away so fast.
The BBL is awesome because it treats so many things. There's nothing it really can't do, but it's perfect
the right
for bruising.
hands.
Yes. Melanie Petro, to be exact. Miss Davis asked if this could be used for lines around the sides of the mouth area. Yes, that is what Volbella was originally FDA approved for, was the lines in the mouth and even around the mouth. Dr. Petro loves the Volbella now, though, especially underneath the eyes.
I've had a lot under the eyes. Also love this right there. It's just so pretty.
Very pretty.
Oh, that's pretty. Now I gotta save some for your brows.
It's always kind of distracting because you can
I know.
see where she
So
injected the needle, but you can already tell the difference between her two eyes.
Oh,
It's very pretty. How does it feel? Are you in pain?
No, not right now. No, not at all.
Well, if you're not right now, you won't be. You won't be
Smile.
later.
smile.
Okay, now we're doing Botox in her crow's feet, and she's gonna get about 20 units.
Ten on each side.
Mm-hmm.
I love what it does for the brow.
She's truly an artist, and I tell everyone you have to be careful
Here
because
you go, you can hold this.
dentists and everyone do Botox now, which I think is so crazy. But
Oh, that
you
looks
want
so
someone
good.
that's gonna look at your face
I love faces though.
and be an absolute perfectionist about it.
I get so distracted. My faces.
It's a blessing and a curse for her.
And this guy's like, you know, she really has an age. And I was like, yeah. I think it's eyes, especially though. People have
Hey,
eyes
Bobby.
really speak to me. When people have beautiful eyes that have skin all around them, I can't focus on what they're saying.
Volbella lasts about a
Noses.
year.
Next,
Botox lasts. How long would you say Botox lasts?
All of
Dr.
it.
Petro?
it's gonna last a year. That looks so good.
Very, very pretty. Are you excited to do your makeup and everything?
I thought I was done.
Alright, so once again, Volbella underneath the eyes.
Oh, that's pretty.
$500 a syringe, which we have rebates for. How much are our rebates? Someone just
So it's
asked.
be 400 because it's 100 off. I think we have 40 more. They'll go through the end of the June. We need to finish our Botox rebates today. If we have any left, nobody will tell me.
We had 4 left this morning.
So this is her easier eye. I really would have made it look better if I'd done this one first. But see, that pattern is so clear.
She is wonderful. She came in not wearing any makeup, which made it really easy.
Just have to go really slow.
Don't mind the obstructed view.
Looks so good. Look even better if somebody would. Come on, there you go. Gentle.
What is the difference between this and Botox? Well, Volbella is a filler. We are doing Botox around the crow's feet, but to fill the
up
volume
for
loss
me.
underneath the eyes, we're going to
Relax.
fill it with
Okay, I see.
Volbella.
Relax. You can close your eyes. Okay. I said relax.
Sorry.
No, I'm
You're
careful.
good.
No, I mean, that's good. I'd rather you move before I have the needle in. But I can handle it if you do. I'm always going to be able to. Look at me. You ready? Put your head back. I can see where it is. It's better than moving it. I mean, I can see right where I'm going. So usually I keep my hand right here so I can feel the orbital rim. It's so fun though when you can see it instantly.
Very satisfying.
She doesn't have that malar flattening over here that she has on the other side. And I can see her, I mean, if you pull down, like here's her vein. I'm trying to avoid it.
Why do you want to avoid the vein?
You tell me, Chloe. What do veins do? Bleed. I don't want her to have a bruise. You're going to have a little bit more. Up your eyes for you. Look at me. It's going to be hard to avoid. I always choose aesthetics over praise.
So pretty.
Now some people do use cannulas. We get asked about that a lot. I just don't like them. It's like trying to go through one hole and do it. You just can't. It's not as good. It's like instead of going from A to B, going to Z and coming back to B, you know? That makes sense to me, but. You okay? She just need a little there. Up here. You're so funny. You're sitting up because you're scared of my mouth. I just realized you were sitting up again. Okay, look.
Everyone says the hardest part is just trying to be still.
Up here. Like relax. Relax. I'm sorry.
She's trying.
Perfect. I'm done with that. This is just so good.
For our people who are just now watching, can you explain what you're doing with the brow?
I am elevating her lateral brow.
So what is left in the syringe of Volbella she's putting in the brow
Chin down.
to give it a little lift.
I'm not going to not do that because of that vein. I'm going to try to get around it. It's going to drive me crazy. It's like an inch of a tiny little, but it's just got to go. There we go. It looks really good.
It's very pretty.
So, I know. I'm sorry. It's got to get to thinking about what I'm doing. Okay. So you did good. Can I have a knife too? Can I dermaplane you? What is that?
Gets the peach fuzz off of your face and the dead skin.
Oh, yeah. Okay.
It feels really good. I know the word knife made you
I
a
know.
little nervous.
I don't want the hair to distract from how pretty this looks.
Did we mention it?
Beezy tries to stab me when she hands me stuff. Only some days.
Alright, you guys.
There you go.
So now we're going to do dermaplane,
Hold a little bit right there. We may need to.
which is the medical grade exfoliation. I'll show a little bit before we sign off. She is just getting the peach fuzz and dead skin off of her face. She's going to make her skin really glow and look really pretty, and all of her products and skincare that she uses home at
see all that?
will go way deeper, give her better results.
See? This is really fun to do to your
Yum.
sister. I was telling them we should have saved all we did from our walk-in clinic yesterday.
That would have been
Gross.
Some of our viewers would have loved it though.
It's better than pimple popping. I mean, it's on the pimple.
I was gonna say I love some of them, just not the pillars.
I'm just trying to look at your pigment too. I mean, it's definitely not melasma. So when you use your products, they'll absorb better from this. The hair definitely doesn't grow back funny.
It will grow back, but not thicker, which is a frequently asked question when it comes to the dermaplaning. How does it feel? Surprisingly
It
doesn't hurt at all.
relaxing.
It
No,
just,
it
just
feels
kind of
pretty
feels
good.
like, something just moving along my skin.
All right, y'all.
I'll let you feel it. Let's let her feel it.
Wonderful day. I'm gonna post some snaps.
Oh, wow.
Doesn't that feel good?
And it makes your makeup go on so pretty and so
good.
smooth.
Botox over here. That would be a before and after. Smile.
So now someone asked the difference between the Volbella and the Botox. This is the Botox. and we're
Botox is
doing
treating
it
mimetic things. It's treating this muscle.
around the eye.
I'm my knife back. sharp side away.
There you go.
We're
Demonstrating
gonna get there.
safety.
No, we're not. Don't video that.
Oh, you can see it even on the knife.
I do the net.
Yes.
You know, the other Chloe's real into ear makeup. I'm real into ear dermaplane.
We all know how people put on makeup and then their ear is still like really red, you know. You gotta hit it with some powder.
Grant even says, "Did you wear your ear makeup?"
Alright, y'all. We're gonna wrap up this video while she finishes dermaplaning. If you still have any comments, feel free to ask or state them below.